Last year, Royal Liverpool and Broadgreen University Hospitals NHS Trust decided to implement a clinical portal to bring together best-of-breed clinical systems through a single view in order to drive the QIP agenda and improve patient care.
The vision for the Trust in terms of using the clinical portal obviously is to increase efficiency and to improve communications between departments and between the clinician and the patient. The clinical portal helps meet the QIP agenda by enabling us to work across different organisations in different settings and reduce pathways. If we make pathways more efficient, that's better for patients, it's better for improving outcomes, and it's better for value for money for the taxpayer.
The ultimate goal of providing the portal is to create a platform that we can then deliver a paperless EPR. Essentially, we wanted a system that would integrate all our best-of-breed systems without having to rip out and replace. It needs to be easy to use, quick to deploy and very easy to maintain. And the Harris CareFX portal provided by CSC was the ideal solution for that.
Sally is a patient that has symptoms similar to those of meningitis, which have led her to attend A&E. Now that the portal has been implemented at the Trust, reception can register her quickly and efficiently. While Sally is in the waiting area, doctors behind the scenes can bring up her information, such as recent results, in preparation for her assessment.
We use the clinical portal a lot. In the emergency department we have a high throughput of patients, and often we know very little about them, and we need to access their previous history and up-to-date records in a very speedy fashion. And the clinical portal helps us there enormously because it gives us access at our fingertips on just one single screen, whereas in the past often what we have to do is log in and out of different computer systems, which takes a lot of time and is very frustrating.
Well, the main benefits of the portal are availability of the notes. The situation in the past was that notes would sometimes be missing completely. More commonly would be tied up in other clinics. So you would have to send out for them, you could wait hours, occasionally more than a day. I see from this that you've got a problem with a rash. I understand also you're allergic to penicillin.
Yes.
Okay. Another advantage is that you are able to order results online. You can do that at the patient's bedside. That's an advantage in that it means that the test is ordered immediately. It also saves money. We used to spend hundreds of thousands of pounds every year on paper forms and the systems to process those, and all of that is unnecessary now.
When the pathologist looks at the sections down the microscope, they like to have as much clinical information available as possible. Previously, we made do with either the information on the specimen request form, or we had to phone up the consultant or the consultant secretary to find out additional information. The portal software is brilliant. It provides all that information at the click of a mouse. There is access to the various blood tests that the patient may have had. There is access to clinic notes that you can sit down and make all the relevant diagnostic decisions immediately.
When the result comes back, you have instant access to it. And in fact, this system has an alerting function built into it as well, which is a patient safety issue. So if there are results that are out of range to the point of being dangerous, then automatic electronic alerts are generated for the doctors involved in the care. So there are both administrative advantages and there are real patient safety advantages as well.
Once Sally is diagnosed, one of the component systems allows the clinicians to do an electronic discharge summary. The pharmacist then checks this immediately and provides to take out medicines before sending the discharge summary out to the GP, streamlining the discharge process and ensuring information is available for follow-up appointments in outpatients.
When the patient arrives, the patient will book into the kiosk, and that will then produce an electronic prompt on the clinical portal. Because the portal is in our outpatient clinics, we then know that the patient has arrived and the patient can then be seen on time while we're not waiting for physical case notes to arrive.
Okay, Sally, I can see that you've not had any other skin problems before.
So when case notes are not there, it's a danger.
I certainly find the flow of patients, and certainly my work pattern since using works a lot better. For example, I arrive in the clinic, I don't see any huge multiple volume case notes. And instead of flicking through all the pages in the case notes, I just look at the screen, which I think is entirely useful and a very efficient way of getting all the information out. For a 3.5 to 4 hours clinic, I was able to save approximately 30 minutes of time. So I can use those 30 minutes of time to either see more patients or see new patients.
We chose to implement the Harris CareFX portal provided by CSC because it seemed to us the best way of ensuring that we got the partnerships we needed working with us as a trust in meeting patient need. They were responsive, they had the product that we needed, and they understood the problem we were trying to solve.
This trust has a very innovative nature. We thrive on new technologies being incorporated, looking at ways in which we can exploit new ways of working. And with the new hospital, we intend to become not just a world-class hospital, but actually one of the most technically advanced hospitals as well.